Can online consultations be as effective as in-person visits for pain management? With the increasing use of online consultations, many patients may wonder whether online consultations can be as effective as in-person visits for pain management. While virtual care has some limitations, research shows that in many cases, online consultations can provide the same level of care as in-person visits. As healthcare professionals, we must help patients understand when an online consultation is a viable option. What is the scientific evidence regarding online consultations? 1. Comparable outcomes for many conditions. Studies indicate that online consultations are effective for assessing and managing many musculoskeletal pain conditions. 2. Validated online assessments. Several orthopedic tests and functional assessments can be performed virtually with proper guidance. 3. Convenience and accessibility. Online consultations improve healthcare access for those in remote areas or with mobility limitations. They may be a good option for people who need care or attention, but cannot leave work or get an appointment that requires travel time to and from the clinic. 4. Limitations in hands-on approach. Some cases require in-person visits for palpation, hands-on treatment, or specific tests. And 5. Technology barriers exist. Older adults and patients with limited digital competency or access may struggle with virtual consultations. How can you address patients' misconceptions about online consultations? 1. Clarify when online consultations are appropriate. Explain that online consultations are useful for initial assessments and screening, as well as for education, follow-ups, and guided assessments. Choosing online over on-site treatment is a shared decision, and good communication and a strong alliance with the patient must be emphasized even more. For example, in patients who need special attention, such as the elderly. 2. Reassure patients about virtual assessment accuracy. Highlight that many physical tests, such as the straight leg raise and functional range of motion, have been validated for remote use. 3. Acknowledge limitations of online consultations. Ensure patients understand when an in-person visit is necessary. For example, if red flags can't be ruled out, there's a noticeable decline in function, or hands-on tests like palpation or reflex checks are needed. 4. Guide patients in preparing their online consultation. Encourage a stable internet connection, proper lighting, and a quiet private space for consultations. And 5. Encourage hybrid care when needed. Suggest combining virtual and in-person visits for optimal management. Let's put it in practice. James is a 55-year-old with chronic low back pain who has completed an in-person evaluation, but is unsure about continuing follow-up sessions online.
James, I know you live quite far from the clinic, and I wanted to discuss the option of doing a follow-up consultation online. How do you feel about that?
I'm not sure. I think I would be more comfortable with being there in the room with you.
That's understandable. But since we've already completed your initial evaluation, our follow-ups will mostly focus on progress tracking, exercise adjustments, and addressing any concerns. We can do all of that remotely while saving you time and travel costs.
That's true. It has been hard to schedule appointments that fit my work hours.
Exactly. With online follow-ups, we can check in more frequently and adjust your treatment plan without you needing to take time off or commute. If anything changes and you need an in-person visit, we can always arrange that. We can do this by phone call or video call, depending on which one you'd prefer.
That actually sounds convenient. I'd be open to trying it.
To sum up, online consultations are not a replacement for all care, but a strategic extension of it. When applied with clinical judgment and clear protocols, they support access, adherence, and outcomes in pain management.